Part 4 is a summary of my post-surgery for my cataract operation. This is the day after cataract surgery. I have a morning appointment with my ophthalmologist. This is where we're going. Now I can see a distance on the left eye and fuzziness nearsighted on the left eyes, which means that you just got to get some corrective lenses to balance the left eye. How you doing? Today is, get this right. Today is Friday. I had my cataract surgery Wednesday, 7 o'clock in the morning. Thursday, I got up and went to my cataract surgeon's office for an appointment for a post-surgery visit. That was cleared. And today, Friday, a couple of days have passed since my surgery. I just want to give you an update, how I'm doing and what I've gone through and how I'm feeling. But just to kind of come back and give a little bit of history. The day or the appointment prior to the surgery, I was given this pamphlet, which is some information, and they had on there a checklist, like checklist for surgery, 1 month prior to surgery. Make sure you have your clearance appointments with your primary doctor. That was done. 1 week before surgery, make sure you have picked up your surgery eye drops from your pharmacy. 1 day before surgery, start using your surgery eye drops as directed. You will receive a phone call from the surgical center as to what time to report, and they told me to be there at 7 a.m. quite naturally for surgery. Do not eat or drink anything after midnight, which I complied with. The day of the surgery, bring all your eye drops to the surgery. Make sure you have a driver with you. My wife accompanied me to drive me home. The day after the surgery, make sure you know which office your appointment is at. Quite natural to know that. You will need a driver to bring you to this appointment. Bring all your eye drops to your appointment, and if you have any questions, call them. And included in that packet was information as far as contacts. It also included surgical information, center information, clearance from my SARS test that turned out to be negative, my EKG, which my cardiologist gave me a copy of just for my information, and other information as far as the medication I should be using as far as eye drops, my post-operation office appointments and stuff like that. That was the good thing about it. It was just that I've had a few procedures in the past where they tell you after the procedure, contact the office and schedule an appointment, and you do, or the doctor might say, well, follow up with an office visit 1 week or 2 weeks after the procedure, and you call the office of the doctor and they tell you they don't have any appointments available. And so sometimes, even though the doctor told you follow up by visiting him 1 week later, you might get pushed off 2 or 3 weeks. You know, it's kind of like you'd be dumped into that appointment category with the rest of the patients. But this facility that did all this surgery and eye examination for me, they were really organized. They, in addition to scheduling the surgery, they also set the post-surgery appointments for me. So it wasn't me having to go out and try to figure out where I need to get appointments. So all that was taken care of. Like again, today is Friday. 2 days have passed. I had the post-surgery office visit. They examined my eyes. They didn't find anything, no issues. They said a little bit of swelling, but that was natural. Don't feel any pain right now. So I guess the question is, how do I feel? And the evening of the surgery, which was Wednesday evening, I was not in any discomfort. The night I slept well. The next morning, Thursday, got up and did my post-surgery office visit, which only lasted probably about 5 minutes or 10 minutes, if that long. He just checked my eyes and said I was good. I have a additional follow-up 2 weeks from now, and then after that, another follow-up, the final follow-up from the cataract specialist 2 weeks later. So I'm guessing by the end of May, I should have a full clearance release from the cataract surgeon as far as okay. Then I go on from there. I go back to my retina specialist, where we get into this planning for the macular eye surgery, which is a little bit more detailed. Now, as far as how I see, it's kind of strange. Originally, I was nearsighted, where I could read objects without my glasses up close, and then to see off from a distance as normal driving or things like that, I would use my eyeglasses. Now, since the surgery, my left eye, which is the eye that had the surgery, I can see distances more sharper and more clearer without my glasses, whereas with my right eye, I still need my glasses to focus. So the issue I'm having now, which is not a major issue, is the fact that I'm nearsighted in this eye, but not in this eye, because before, when I used to wear contacts for distance, I always had to buy over-the-counter reading glasses just to read up stuff close. So even though I would have my contacts on, I would have to put the reading glasses on if I was reading. And that was, I guess when I was working, that was more needed, because my office was, my job was more or less an office job. So I was always around a desk and table and reading stuff and writing stuff. So it was very helpful not to have to put on reading glasses in that environment. But since I'm retired, I read a little bit. I look at, search the internet on my tablet. So whether I'm nearsighted or farsighted, it doesn't really matter. The only thing now is that for me to see a distance with my glasses, kind of like if I put my glasses on, this eye is in focus, but now since they corrected this eye with the cataract surgery, this eye shows a blurredness. So it's almost like I have to, if I really wanted to look at a distance, I would have to kind of do like this. So now this is in focus for a distance, and then this is in focus for a distance. But like the doctor said, that we'll adjust that when the time comes, and we'll move forward. Oh, they gave me this little packet, and as far as the surgery is concerned, and in it, in addition to the little thing, I carried my eye drops. Eye drops. There's 3 of those. Some contact information. Some cool sunglasses for UV protection. Check this out. Alright, what do you think? Looks good. Okay. And then they gave me in here, which is the strangest thing they gave me. They gave me this, which is a protective cover, and some tape. And this is supposed to go over at nighttime my eye like this. But the problem with this, it is so flat until it basically rubs against my eye, which is, you know, the purpose is to protect my eye, but it rubs against my eye. And then the problem on top of that is that you would have to tape this, and I couldn't figure out where to tape this and not pull off my eyebrows and, you know, and my skin. But once you put it on there, it felt more threatening to my eye than protection to my eye, so I didn't use it. What I used instead was, let me get it. I had gotten a couple years ago this Dewalt Goggle package, and I had never used it for my workshop area, and I was trying to figure out what else could I use to protect my eyes at night versus this thing, which really didn't do anything for me, and came across this. This worked. This worked even better. These are goggles with the elastic in the back, and if you look real carefully, it's air vents all the way along the top and on the bottom, so these do not fog up, and once you put them on, you do not sweat with them. But the way they look, it's like that. Now that provides protection. Now they said you need to put something like this over your eyes so you don't rub your eyes by accident, and that's true. I woke up a couple times with my fingers like this, trying to go for that eye, you know, during my sleep, so this is helpful. So if you want something like this, I'll leave down in the comment section below a link to these. I think they're like $12 or something I got from Amazon, but they work. And also, if you wanted to get tinted, you can get a tinted version of this outer cover if you wanted to. But I used this at nighttime instead of this thing, which didn't provide any protection for me at all. And in addition to that, I use a Cpap at nighttime and trying to figure out how to work this together. But I just took the the front of my Cpap with the hole that comes off of there, right there, and I took my goggles. Hey, check that out. Doesn't that look smart? Now I can see, it feels cool, the air is flowing through, it's not fogging, it's an anti-fog goggles, and it feels very nice and comfortable. So this is something that if you're trying to figure out in anticipation of getting something like this with your surgical packet, you might want to get something more like this. These are $12, and afterwards you can always use them for any other times you want some eye protection and stuff like that. So that's something to consider. So now what my next thing you know, this is probably going to be my last video part for a while, because like I said, my next appointment is 2 weeks from now, and then I'll be issuing another video to show you the results of that 2-week visit. If anything occurs between now and that 2-week appointment, I'll issue another mini video part just for your information to keep you informed of my progress. But again, in summary, I had the cataract procedure Wednesday morning, followed up with a post-surgery doctor's visit Thursday morning. I'm recording this Friday midday, noontime. The first night after surgery and the day after, no issues. I continue with my drops, which are like each bottle I have to do 4 times a day, and this is going to last. The way it looks like the way they got it scheduled, is going to last for the next month, and it's going to start dropping down from 4 drops per bottle to 3 drops, to 2 drops per bottle, and then finally toward the end of a 30-day period to like 1 drop per bottle. And I think that's it. If you have any questions, feel free to drop them down below, and I'll try to answer them. But I'm I'm going through this for the first time, so maybe if you have a comment, maybe some of the other viewers might see your comments and who've already been through this a little bit farther advanced than I am. They may be able to provide some comments or some answers to your questions. Again, this is just the voyage that I'm going through, and when something's new, it's unexpected, you're not sure what to anticipate. So I'm generating this video for those who have this pending circumstance, and so to kind of give you an idea of what to expect. I was looking on YouTube, and I see a lot of professionals about the procedures and stuff like that, but sometimes you want to hear from a person a patient who actually experienced this, and hopefully that's what I'm doing to make it easy for you. I have not had any issues with the surgery, and if you want to see my eye, let's get up a close up here. Now this is, let me brighten this up a little bit. This is the eye that had the surgery. I hope that's in focus. And the right eye is the one without the surgery. But like I said, I can see much better from a distance with farsightedness with that left eye now. One of the things I'm thinking about is that maybe I might, as I get through all this, talk to my eye doctor and see their opinion as far as either going through another cataract surgery for my right eye or LASIK surgery, just to put that farsightedness in both eyes. Because right now, if I can explain the way it looks, the left eye looks like looking through a window that is pristine and clean, and the right eye is sort of looking through a window that's a little dirty and hazy. It's not noticeably a big difference, but it's just that surgery did a lot. Even though I have the macular issue with the distortion of images, the sharpness of my vision is much better from a distance with this eye now than with my right eye, which did not have the surgery. So keep that in mind. That's Bob, and I'll talk to you later. Bye-bye.
Robert, you want a cup of coffee?
Yeah, I'll take a cup. Thank you.
Stay tuned for more parts of this video as I go through my eye surgery.